Good evening. Thank you, Bernard, for your kind introduction. My topic today is navigating Canada's healthcare system. My presentation will be divided into 6 parts. I want to begin with an introduction of Canadian healthcare system, then move on to Canada Health Act and its 5 principles, federal versus provincial territorial government's roles, 3 functions of the Canadian healthcare system, 5 levels of healthcare. Then I will talk about primary healthcare versus primary care services, secondary services, supplementary services. I also will discuss about urgent primary care center and wait time. And finally, I will conclude this section in Chinese. Let me begin by giving you some general information about the healthcare system in Canada. Canadian healthcare system is publicly funded and provides universal coverage on medically necessary healthcare to all Canadians. And the healthcare system is led by Canada Health Act and its 5 principles, which are universalities, comprehensiveness, accessibility, portability, and public administration. Canadian healthcare system is administered on a provincial or territorial basis within guidelines by federal governments. And I include a link that is a video about Canadian healthcare system. Canadian healthcare system provides preventative care and medical treatments from primary care physicians, as well as access to hospitals, dental surgeries, and additional medical services. There are several types of healthcare service, which include health promotion, disease and injury prevention, diagnosis and treatment of existing health problems, and rehab. Canadian healthcare system is an integrated healthcare delivery system. It's a network of healthcare organizations that provide or arrange to provide a coordinated continuum of services to a defined population. Now, let me begin. I'd like to move on to Canada Health Act and its 5 principles. And they are comprehensiveness, universality, portability, accessibility, and public administration. Comprehensiveness. Comprehensiveness means that refers to the provincial and territorial government that their plans must ensure all medically necessary services provided by hospitals, medical practitioners, and dentists working within a hospital settings. Universalities refer to all the provincial and territorial plans must entitle all insured persons to health insurance coverage on uniform terms and conditions. They should not have discrimination based on race, gender, income, ethnicity, or religions. Portability. That means the provincial and territorial plans must cover all insured persons when they move to another province or territory within Canada, or when they travel abroad. The province and territories have some limits on coverage for services provided outside Canada and may require prior approval for non-emergency services delivered outside their jurisdictions. Accessibility. The provincial and territorial plan must provide all insured persons reasonable access to medically necessary hospital and physician services, regardless of income, age, health status, gender, or geographic location. They should not ask additional charge. Public administration. The provincial and territorial plans must be administered and operated on a not-for-profit basis for public authorities accountable to the provincial or territorial government. Now, I'd like to move on to discuss the federal government's roles and provincial and territorial government's role in healthcare system. The federal governments, they set up and administer national principle for the system under the Canada Health Act. This act is a federal act and not provincial act. And they provide financial support to the provinces and the territories, and the funding and the delivery of primary and supplementary service to certain group only. And those groups include Aboriginal people of Canada, military veterans, RCMP, and federal inmates. And other federal health-related function is they regulate health products. While provincial and territorial government's role, they administer health insurance plan. So they plan and fund the care in hospitals and other care facilities. And they fund services provided by doctors. And they plan and implement health promotions and public health initiatives. And they also regulate health professionals. So health product is regulated by federal government, and health professionals is regulated by provincial government. They also negotiate fee schedule with health professionals. And they fund supplementary benefit for certain groups. For example, low-income citizen, resident, they can get support from the provincial government and senior peoples. They also, you should know, supplementary health services are largely financed privately. And private insurance are restricted from offering coverage. They duplicate public funded plans. So there's no duplication between private and public fund. Now I'd like to move on to three functions of the Canadian healthcare system: finance, funding, and delivery. What does it mean? Finance is talking about how the money moves. So that refers to the manner in which dollars is transferred from consumers, taxpayers, directly to the providers, or indirectly through intermediaries, for example, insurers, regional health authorities, who then pay the providers. And the payment can be made in the forms of taxes, insurance premiums, or direct out-of-pocket. And how is our current system financed? Money comes from government taxes, or pay for the insurance, like Blue Cross. Employers sometimes pay for some of it or all of it, and out-of-pocket. Second, funding. What the dollars pay for? Funding refers to the way provincial and territorial health plans pay to the providers of care. So they include physicians' fee for service. They are paid separately for each service provided. Or they pay hospitals' overall global budget. It's a lump sum budget, lump sum payment adjusted annually regarding number of numbers, types of cases treated, or number of bed stays. Third, delivery. how the service provides to the public. This delivery refers to the manner or methods in which healthcare services are provided to the public, including client prescription ordered by a physician but funded by private insurance or by the person's out-of-pocket expense. And currently we use this public and private situation, but in the clinics. So we have private surgical clinics, but they need to work with the principle under Canada Health Act. There are two influential national reports. They review medical care and recommend policy and measures. The first one, called Kirby Report, they recommend privatization, and Roman Now Report, they recommend continue the long sustainable public system. We also mentioned the scale healthcare system is administered, delivered by BC's Health Authority. The province 6 health authority are the organization primarily responsible for health service delivery. And there are 5 regional health authority. I think they all know, you probably hear about that. For example, Vancouver Coastal Health, Fraser Health, Interior Health, Island Health, Northern Health. And there is also 1 provincial health service authority. And this authority, PHSA, is responsible for 13 province-wide healthcare programs and services, such as BC Cancer Agency, Cardiac Service BC, BC Center for Disease Control, and BC Transplant. There are 5 levels of healthcare. I mentioned earlier that include health promotion, disease and injury prevention, for example, screening, immunization, and what we do, vaccination, and also lifestyle change and support groups. You may be more concerned about diagnosis and treatment and recognizing and managing your existing health conditions. There are 3 sublabels. The first, primary care, and first contact, usually in GP office, like a family doctor, in the clinics, in the school. And they focus on early detection, routine care, and education. Secondary care, usually in hospital or home settings, they specialize medical services. And clients require further diagnostic review. They also go to secondary care. Tertiary care are those specialized technical care. They occur in regional or specialized hospital. They perform more complex procedures. The 4th level is rehab. They restore person facing life-altering health situation. For example, they recover from after illness, injury, addiction, or chronic illness, disability, fragile, aging. So they try to assist to return to previous levels of functions. The final one is supportive care, include pediatric respite care, and for chronic or progressive. So they provide the care over a long, prolonged period. Now, Canadian healthcare system is based on primary healthcare services. And that is the first point of contact in the healthcare system. They have 2 functions. The first function is they provide direct first contact service. So you have a flu, and you come to the doctor and to do some review. And the second function is they will coordinate patients' healthcare services to ensure continuity of care and ease movement across healthcare system. So they might refer you to a specialist or refer you to hospital or other healthcare facilities. Secondary services is the services after primary healthcare services. A patient may be referred for specialized care at the hospital, at a long-term care facility, or in the community. Secondary healthcare services may also be provided in the home or community or in institution, mostly for long-term and chronic care. For the most part, home and continuing health services are not covered. However, all the provinces and territories provide and pay for certain home and continuing care services. And in general, healthcare services provided in long-term care facility are paid by the provincial territorial government, while room and board costs are paid by individuals. So they didn't pay everything in the long-term care facilities. Supplementary services, they provide the provinces and the territories, they provide coverage to certain people, such as seniors, children, low-income residents for health service. They are generally not covered under the public funded healthcare system. Supplementary health benefits include prescription drugs outside hospitals, dental care, vision care, medical equipment and appliances, and the services of other health professionals, such as acupuncturists. Primary care versus primary health care. What are the differences? The primary care system refers to the first line clinical service. They provide an entry point prior to healthcare system. So you go to the doctor or nurse practitioner and they give them and decide if you continue the first line care or you need to be referred to specialist or hospital. And when we say primary care is a medical term, wherein the physicians provide diagnosis, treatment, and follow-up for a specific problem or disease. And we also talk about primary health care, but this is a more philosophical idea, a model for improving healthcare, improving health, and that supports essential healthcare services with a strong emphasis on the principle of health promotion and disease preventions. Okay, now let's talk about urgent primary care center. This is quite new for a lot of people. My student and I, we done a project in 2015, 14 maybe. So we already we already have some idea. When we have a first primary care center. Now we have 25 centers in BC and 11 centers located in Vancouver Coastal Health and Fraser Health. And there are 4 centers located in Burnaby, Maple Ridge. These centers require appointments. So generally speaking, you don't need appointment. You can just drop by, and they usually open from 8 to 10 p.m. 7 days a week, including holidays. Urgent Care Center offers diagnostic services and testing, including X-rays, blood tests, urine tests, ultrasound, CT scan, and ECG, EPCC serves people of all ages. The triage and the wait times, patients are triaged by a registered nurse. Triage is the process of determining how urgent a patient's condition is based on potential for their health to deteriorate. So patients with most urgent needs will seen and treated first. So it's not because you first come or first serve. It's based on who needs most or first. So there are some comparisons that we did about what's the difference between emergency department, urgent care primary centers, and primary care clinic. And the major difference between emergency department and urgent care is urgent care primary center doesn't deal with life-threatening emergency. They do deal with some immediate care, but not life-threatening emergency. And they open to, so you can drop by. They can treat most serious condition and then just primary care clinic. For wait time, according to OECD report in 2020, wait time for health service is a policy issue. So we can go to the BC government, they will tell you how they decide, because that is a policy, how they decide the wait time. There are several different kind of wait time, but here it's more general. People might want to ask, is emergency department wait times. And Fraser Health, compared with Vancouver Coastal Health, their wait time is much longer. Depend on other reason, maybe resources is less. And when you consider wait times, you don't just compare how many hours. You also need to consider how other patients require more urgent care. And if you need additional tests, if you need a lot of tests, so your wait time and your length of stay will much longer. And maybe there's an unexpected situation. Maybe there's a natural disaster or traffic. And also there's other reason you need to consider. That is when you arrive at a very busy time. So if you arrive at a very busy time, you probably need to wait, especially when other people is more urgent than your province. Okay, I just summarize briefly in Chinese, so you understand. If you're not very clear about the English, you might want to more understand about Chinese. So I have some Chinese conclusions. 加拿大医疗卫生系统，它是一个单轨的公立系统。它是依据1984年加拿大卫生法案的5大原则设计的，然后是由各省和地区去制定这个健保计划，实行全民公费医疗以及医药分离。医疗照顾是由省政府负责提供，医护人员由省政府规管，联邦政府呢，它则负责制定政策，而且还要监管省政府是不是根据这个原则这个政策去确实执行。那他们也做药品的管理以及他们会把纳税人的钱分配支付给各省的医疗需求。受保的医疗照顾呢，包括医院服务，还有医生的服务 physician service， 还有外科牙科的服务。加拿大的医院全部都是公立医院，没有私立医院，但是它可以容许私人的诊所。加拿大约有70%的医疗支出是来自公共来源，那30%呢，就是来自像保险公司或者你自己掏腰包。加拿大的系统是采基础医疗初级医疗，我们 primary care。初级医疗提供者是第一个接触病人的人，我们通常也都会认为那是一个 family doctor， 当然他可能也是 nurse practitioner， 或者是你在clinic 一个 walking clinic 的人的医生，那他们会提供你后续主要的医疗照顾。那在病患有需要的时候，他还会帮你协调其他专科医师的医疗，比如说你需要 specialized care， 或者你需要住院你是从这个基础医疗里面去得到转介的，不是说你直接跑到医院里面说我要住院，你就可以住院。 你待会如果还继续有问题的话，我们有问答时间，本论会主持，我们再来回答。谢谢。